skill that you've developed, or a behaviour?
May I start?
Yes.
Social media has been the thing that saved me in the last few years. From about 2010, I've been actively engaged in Twitter, mainly Twitter, also Google Plus and Facebook. But the Twitter conversations with people from around the world have been immensely empowering and have kept me safe.
And is that with people in general, not medics, but people in general?
Generally medics, but also
really generally medics.
In the last 6 months it's been with patient groups. Thyroid, I've developed an interest in thyroid disease and B12 deficiency as a result of those conversations.
Right, excellent.
And written about it in my blog.
Wonderful. So you've done that over the last 3 years?
I'm not a favourite person, so I'm away to God, but it's not is that not a very open way to expose your kind of questions? I mean, if I understand the trigger is a word right thing, you know?
Absolutely, it's fantastic.
Okay, so tell me kind of a simple, nervous Irish doctor who would be a little bit nervous about, say, exposing his hopes, dreams, expectations to the world of Twitter, how you got so much success with this?
I would say my name's David. I'm a GP in the UK, originally from Australia, which gives me probably makes me more open perhaps than some of my British colleagues.
To what?
Didn't say that. I imagine Irish people would be much more outgoing than their British counterparts. My experience is that 5% of my colleagues are engaged on Twitter, and the other 95% are like you, who are concerned that Twitter is just about talking about going to the toilet and other various precarious activities. It requires work, like everything does, and it's taken time. I've had 3 false starts before I got it just like I. And you've got to mould it, and just like you do with your family and your workplace and your colleagues, you have to have a goal, an objective, and it's another stress in a way that we have here. It's sort of one of the reasons you don't engage. I'm stressed enough already. I haven't got time for that. I want to have real people. I want to meet people in real life. I see Twitter as a global consciousness. My friend says it's a collaborative IQ. It is. Claire Gerarda told me at breakfast she won't go on the media until she looks at the Twitter feed to see what's going on, so she can reflect the public consciousness in her statements, in media presentations. Sometimes it gets cancelled, but she will look at Twitter before she makes a statement so that she tries to chime with the public mood. Does that help?
And to avoid the 3 false starts in a sentence. How do you avoid them? Maybe someone else can talk.
We might come back to you on that, David. Thank you.
Just coming to the problem of exposure, if you want to avoid that, I'm a rural GP in a very remote part of New Zealand, and so have real difficulty getting to peer group meetings. We now have a Skype peer group meeting, which meets every couple of weeks, and that's actually been a major saviour for me when I was getting very oppressed with administrative issues. And it's very easy, and it's a closed group, and we get a lot of value out of it. Does anyone else use Skype to interact with other GPs? Yeah, we're all rural GPs, so it's quite closed in that respect, but we also have known each other from meetings and other collaborations over the years, so that also helps. We also see if we can find an opportunity to persuade somebody to fund us to meet face-to-face every so often. Doesn't work.
Yes.
I work together with another GP, and most times just enough to just walk into each other's surgeries and just blow off steam. And we know that we can do this to each other, so you can walk just in between patients and, well, your time management will fall apart. But it's so helpful to be able to immediately discuss something with it, and we can be a bit critical to each other. It's nice. We have more than somebody who's, such a pity, and no, it's nice to really blow off steam and just get something back. Like, okay, was it really the patient's fault or something?
So you both benefit from even just a few moments or
yeah,
a few minutes?
just a few minutes. You must have it with your group, close group.
Yes. I worked in a busy practice in the UK from 19 91 to 96. There were 4 partners in the practice, and we each met at coffee break after the morning surgery. And then we got busier and busier, and some of us didn't get to coffee break. And sometimes there would only be one GP. It was always in one of the GP's rooms. Sometimes he would be there on his own, and none of the other 3 of us would go and meet at coffee. And then one Saturday, we were in, one of us was doing a Saturday morning surgery, the other 3 people were off, but we were all in doing administration. And when we realised, we said, stop, we have to change this. We are not to come in here on Saturdays, and we are going to meet each other after coffee and the morning coffee break. Even if there's things to do, drop it and let's meet. So it was a facility to vent, and it was also very good for passing information to each other about patient issues going on, things going on with certain families that we should really know about, instead of living in our own worlds, interacting with people in our own room, and that was it. Does anybody else communicate like this in their workplaces?
I sometimes go for a walk with my partner and register at lunchtime. We live in quite a rural area, and if it's, if you have half an hour break at lunchtime, we'll sometimes say, quick lunch now, let's go for a walk. And we talk about all sorts of things and come back refreshed in a way you wouldn't have been if you stayed. And it means making time for it, but it's good.
I find the atmosphere towards GPs in Ireland is kind of hostile from media, and I found standing up to it and writing letters into it hasn't published has been cathartic for me, actually, to be honest. Yeah, and it's nice when they come up with statistics, like the new Minister of Primary Care or Health Minister comes up with statistics. Obviously, there's a new report out, and it's junk. And you explain it in flowery language why it's junk to be published, and I find that it gets it out of the system, to be honest, because the lack of taking away our autonomy, taking away our not acknowledging the benefits we're bringing to the whole health equation in Ireland, and not acknowledging the value we bring to it, and just always talking down to us and telling us what to do. I found that a few years ago during the swine flu quite stressful, to be honest. Yeah, and I thought my way of getting back is saying, no, you're wrong, and not bothering with peer review stuff because it's too hard, and just go for it. I spoke to a professor about this, an academic professor, and I said, listen, I'm pissed off. And I said, what's going on here, all this rubbish, and I have this paper I want to do. He said, listen, you could go down an academic route and really do it. I could do 10 times the amount of work and get it into the media, right? And that might be far more effective than getting people to follow up with you, actually, or then join you. And I found that, like, Ireland's a very small country, it's only 4 million people, 4.5 million people, so there's very few GPs are actually interested in doing something like this anyway. Not like the UK, there's a much bigger population, you have 10 times the number of GPs interested in engaging with national policy. There's very few GPs interested in national policy in Ireland. And I found that it's been interesting to get people to engage with you. You have a problem, to get other people to join you and help you along. It does help, actually. Shares the burden, and there's a bit of affirmation when you get results out of it as well. Satisfaction. We want autonomy, we want variety in our work, and we want satisfaction. And we want kind of and satisfaction is just not just about remuneration, it's about more than that. We don't be wasting our time doing things we shouldn't be doing. I ignore a lot of guidelines for payments as well. I don't think they make sense. If it doesn't wash, I don't do it actually. It has to make sense to the patients, international best practice. But if it's an Irish guideline for payment, you have to sign, patients to sign a form so the GP gets paid. I'm told we don't sign forms in our practice, and I could be audited. I will never be audited by Department of Health. But it's not. You have to run your practice the way you think it's right. And if guidelines or protocols are out there and they're damaging patient care, you have to stand and say, this isn't right. Just take responsibility for it. That's another way we work in our practice. We don't sign STPs.